അസൂയക്കും കഷണ്ടിക്കും മരുന്നില്ല. There is no medicine for jealousy and baldness. So you're telling after 3 months or 4 months, I'll be completely, this area will be in current situation.
After 3 months, as far as the soft tissue healing is concerned, it will, in a very advanced phase, it will be near completion. As far as your transplanted hair is concerned, and you will get noticeable results only after 6 months.
I used to be a good alcoholic. So luckily, I think alcohol will not help. Will have
Alcohol will have a negative impact. So you need to avoid all that.
When can I restart gym after this procedure? Lifting weights and all this is not a problem. But I'm very much addicted to it.
Body is stressed during a surgical procedure. Plenty of things, metabolism and everything is going on inside the body. We need some time for the body to stabilize and get to its own.
After this, how long should I be inside the home? Will I be able to go out?
A bit of healing occurs, rest of 5 to 7 days. So you have to avoid basically unhygienic conditions. Hygiene is very necessary. Proper head massage and everything. Implantation after 1 month. PRP will not have any side effects because it is ultimately your own body composition. There are certain foods which will help you maintain your hair that you have got transplanted as well as your natural hair.
What is that?
And all those are...
How can I guarantee that the people doing in Haircraft are experts? Hi, sir.
Hi, Vijay, how are you?
I'm fine. And excited that next week I'm going to be more, glamour. Since you are fully into English,
Yeah.
Some vigaram which we tell in Malayalam
Yeah.
can come only from Malayalam.
Exactly.
So I'm excited actually because next week the procedure is planned.
That's great to know.
So
And definitely we'll give our best and have you look maybe 10 years younger.
that is good. See, I had a few questions to you.
Yeah, sure.
I had a dream for some time. It was a dream for me
Okay.
to grow my hair and put it like this. Ponytail and all this.
Ponytail, right?
So I just want to
Like
know.
you see in the movies, right?
Yeah. So I tried it actually. Recently, I do videos.
Okay.
I'm a vlogger basically.
Oh, that's great.
An entrepreneur into restaurant
Okay.
and into real estate.
Wow.
I did a film also, an actor also. So
So many personalities combined into one. Definitely, you'll
small
look
film
good.
actually, but expect in the future something
Yeah.
more will happen. My the dream, or I was coming to the point,
Yeah.
that ponytail. So will I be, after this transplant, will I be able to grow big? Before that, I just missed it. I tried it some three months back.
Okay.
I tried to grow the current hair.
Okay.
So what happened is that it became like, again in Vigaram, Malayalam Paranam.
Right.
We talk പന്തലിട്ട പോലെ വന്നു എന്നുള്ളത്. In videos you can see I do it daily.
Yeah.
Zigzag here and there and it looked very awkward.
Yes.
And then is what I thought about doing a transplant. So my question is, after doing the transplant, will I be able to do that ponytail stuff and will the hair be stable?
Sure. It will definitely be stable. It will also depend upon how you take care of your transplanted hair. It will include your lifestyle habits, hydration of the scalp, sleep cycle, type of food, oily foods. If you avoid all those things, will definitely help your hair keep stable. And also a few supportive treatments like PRP, GFC, we can provide so that you have the most efficient result.
Somebody told me if I transplant, I can't grow beyond a limit. Means that hair will be there, but I should be cutting it time and then, or every month I should cut it. I can't grow it, or the hair can't be longer.
Okay.
I got an information? Is it right or?
No. You can definitely go longer with your hairs. Again, the care of your hair is of utmost importance. It is how actually it also depends from person to person. Some people where there is DHT or you can say that hormonal effects are greater. There we may need to keep it at a certain limit, but again, for some individuals, definitely we can go increase your length of your hair and you will definitely have good results.
Okay, how can I know whether I will be able to grow it or it will not go? Because once this hair from here, it is placed, if it goes, then it will not come again, no? Will it come again? I don't know the whole process.
Actually,
Could you
yeah.
please explain the
So,
whole?
yeah, definitely. So
I'm a bit excited to know how the process it actually is
Okay.
actually.
So the procedure, what the procedure is basically, procedure that we are planning for you is FUE. There are other types of procedures for hair transplant like FUT, a long hair transplant, all those things. And the most popular one is the FUE, which we are planning for you. In FUE, what we do is follicular unit extraction. In follicular unit extraction, we place micro punches in your donor area. Donor area will usually be at the back of your scalp, back portion. So from that area, why do we take from there? Because that in that area the effect of DHT, that is dihydrotestosterone, is very less.
What is it?
Dihydrotestosterone.
Oh.
This is the primary reason in males for baldness, the hair loss, because it then binds to the hair follicle, makes it thinner and all. So to overcome all those effects, we need an area from where we can get the grafts which is free of that effect. So the back of your scalp is such an area where we can perform, because it is a DST zone. So we can take your grafts from there. So what we'll do is we'll put micro punches, and a small amount of tissue along with your hair follicle will be extracted from that area.
Okay.
It will be collected according to the number of grafts what we need for the coverage of your front area.
Okay.
That much grafts will take. We will then implant it back to the area. The markings will make the type of hairline which your naturally will look good with your face. So with those proportions, facial proportions, we'll mark those hairlines and we'll fill all the area which is thinned out or bald. After that, when the follicle will grow hairs, then it will have a very good and appealing, and it will look natural.
Okay. I have a doubt. So you take something from here, so will that grow again?
No. So just think of it as the follicle is a tissue from where the strand shaft of hair will grow. Okay, so we are taking that whole follicle away from there. So once we are taking that away, we are taking that bed away from where that hair is manufactured, you can say.
So here will it look awkward or?
No, it will not look awkward, because here again, as it is a DHT free zone, the back of your scalp donor area is a DHT free zone. So there will be a lot of hairs which will not have thinned out yet, and there will be good amount of density.
Okay.
So out of density, we'll take your graft in such a way.
There is some good density for me.
Exactly. Definitely, it will be there, because that's a DHT free zone. So what will happen is, since there is a large amount of density of hair follicles, even if we take some follicles from there, there are too many follicles spread around to mask your scalp. So the natural looking hairline hair that you had at the back of your scalp will still be present, and we'll also get the graft that we require to give coverage with a good density at the front of your
In this
scalp.
condition, how will it be? It'll look completely
definitely
different.
Because as I can see, this donor area is also good. So we are expecting to get more amount of grafts to cover larger area.
So everything will grow here. I mean, what are you?
Yeah, whatever follicles we are taking from the back of your head, we'll implant it at the front. That will continue growing. There's also a life cycle of hair with that. Initially, there will be shedding of your existing transplanted hairs, and then after a few months, a new hair will grow in that follicle itself, and eventually, after 6 months, you can expect to see some visible results.
See, taking my case, the date is fixed for 17th and 18th.
Yeah.
So from that day, how is it? Can you please explain how much rest and all this? I go to gym,
definitely.
Workouts.
Yeah.
Going out.
First of all, you have to be completely relaxed before the procedure, since it is a surgical procedure. We need all your vitals in a balanced range, in a range which is acceptable.
Yeah, I was told to take a big set of blood tests and all these I'd given.
Yeah. So all your parameters, routine blood examinations.
That's all finished.
Your vital, like your SpO2, your blood pressure, your pulse rate, everything has to be in a normal range. We desire that so that we do not encounter any adverse results during or post the procedure. So that is of utmost importance for us, and we emphasize on that, because for us, patient safety is of paramount importance, along with achieving the best results that we strive.
Once that is done, how you'll take the whole hair, or how is it? You will take off the whole hair?
So yeah, then again, as I told you, the procedure what we are planning for you is FUE. So there are 3 types of procedures. Basically FUE, FUT, and one there's a new technique that some surgeons have started practicing is long hair transplantation. So in FUT, what the procedure is that we'll take a strap of tissue, scalp tissue, by giving incisions around it, and that much area will take. Then under a microscope, we will separate the follicles and then implant at the front of your empty bald area. In FUT, what we do, we'll not take the whole strip of scalp.
I was told.
Whole strip of scalp. We'll just we'll have a micro punch. Pen. It is sort of a punch. It will have a punch with hollow tip. With that tip, we'll go around your hair follicle, around with some amount of tissue around it, and we'll extract it from there. And that unit, follicular unit, we'll be transplanting it back to the front of your scalp.
See, actually, so this hair will be shaven off.
Yeah. So what we'll do is we'll shave off your entire hair because in follicular unit extraction we need to, since we have to get more amount of grafts, we need a clean shaved area. So from that shaved area we can get more number of grafts in comparatively lesser time with less effort. So we'll go for that. So your completely your scalp will be shaved off, your implantation area as well as your donor area. So we'll shave it off, then we will take you up for the procedure. Then you will undergo local anesthetic for numbing out the areas that we'll be performing the procedure on. Thereafter,
I can see what is happening.
Actually, during extraction or implantation, we'll ensure that you're in a relaxed state. So you will not be seeing any procedure is going on. You will be lying down. While extraction, you will be lying down, face down in a prone position, and then during extraction you will be lying down face up in a supine position. So that is
but I'll be conscious.
Yeah, you will be conscious. Yeah, if you have to ask something during the procedure, you can definitely go ahead and ask.
That is fine.
So yeah, so that
and after this, how long should I be inside the home? Will I be able to go out?
Or so there will be some downtime for you after the procedure is done, since the surface will be raw, as the implanted surface as well as the donor surface. So we need some time for it to heal.
Okay.
So usually I'll advise rest of 5 to 7 days so that a bit of healing occurs.
Which I'm definitely okay for it, because with glamour, health also should be taken care of.
Definitely. What happens is, in today's fast-paced life, people don't have so much time to take downtime after surgery.
So I planned already. Because I am doing business in partnership, so everything is assigned so that I am completely relaxed.
Exactly.
When I would love to be a new person or revamping or restart or something like that.
Actually rebooting yourself.
Yeah, correct. You told
right.
the word.
You will actually getting a new appearance is like getting a new identity all over again.
That's what.
Because ultimately you are getting a second chance in life, you can say, at least with your appearance. Right.
Because we all feel that we will live for 300, 400 years. It's not happening. So 7 days
so 5 to 7 days is okay.
Pure rest is required.
Pure rest is required, and also
without going outside, staying inside the home.
Calm environment without stressing you out, because the last thing we want after surgery is stress. We want a very smooth and proper good healing. That thing is very important for your results also, and your donor area.
After 7 days?
So after 7
and one more thing, will I be able to bath?
Yeah, for initially, until your clot removal is not done, for the first 5 to 7 days. After 5 to 7 days, you will be called for clot removal. Clot removal will be done. Thereafter,
will it pain?
No, it will not pain. It will be a painless procedure. You don't have to worry about. Everything will be explained to you by our trained, very experienced and trained staff. They will guide you through the entire journey. You don't have to stress about anything. You just have to be in the moment. Just follow the instructions. Our care will be there, and we are there for every step of the journey.
So after that, will any shredding? What is that? Hair will go away, no? After that?
There will be a normal shedding phase also. So visible results you can expect after 6 months.
So after 7 days, I can go out and be normal.
Yeah, but then again, you have to be careful with the environment you are going into. You
Okay.
should not be in an environment where there is too much of exposure of your surgical area toward, you can say, dust or
Oh.
allergic particles or what.
Should I take care in that aspect?
It will be advisable if 3 weeks to 1 month you can avoid your exposure. Just be in a clean environment.
I understand.
If you bathe with water that is you can trust that this water is for your daily usage, not any random any place where the water can be contaminated, because that can lead to complications like infection, which is again we don't want, because that interferes with the result is very paramount for that is for the reason why we are doing the entire.
So till 1 month, it is better. We should be taking completely. I mean, not rest. I'm telling. We can go out after 7 days, but should be taking care.
Yeah, you should be taking
Sunlight.
care. Yeah, exactly. Sunlight a bit is okay. Overall, you don't have to like you can say that overexert your
Understand.
scalp in an environment which is too dusty. You
Okay.
can say, or which an area where you're sleeping in somewhere pillow or anything is not very clean, unhygienic conditions. You have to avoid basically unhygienic conditions. Hygiene is very necessary. Proper head massage and everything, implantation after 1 month, all those things will lead to good outcome.
And after this thing you told about shedding and the whole process. So next haircut, when should I be doing?
When you observe that you need a haircut.
Oh, that's it. There is no. That is the hair will be growing as normal.
As normal, it will be definitely as normal. You can even style it in a particular way. But then again, I will advise against using any products which are not reliable, which may give good results in styling for short term, but in the long term, that may have negative impact on your hair.
That coloring and
Like
all those stuff.
wax. And all those things, coloring, hair color, dyes, and all. So you need to avoid.
I don't plan now
Yeah.
or in the future also for that.
Yeah.
So I understand. That is it. And see, whenever I told even my family is very much stressed that I'm going to do this, because recently in news and all these what is it,
definitely.
worm eating skull, all those stuff I've been hearing.
Flesh eating bacteria.
Yeah, first time I'm hearing about that.
Necrotitis.
Yeah. Something that happened in Cochin, and many my well-wishers told that don't do all those stuff. But there are some people who did that and happy. So
such type of cases happen in when there is an infection.
Okay.
So infection, there are few reasons why infections can happen, right? First and foremost, you are not keeping the area clean, or the procedure has been done in a manner which has not followed proper sterilization protocol. Okay, so first we need to ensure procedure that my scalp is devoid of any existing infections. It is clean, washed. Okay, the surface is clean. Then during the surgery, all the sterilization protocols are being followed. You have to also ensure that the procedure that you are going under is being performed by a trained, qualified surgeon, like a maxillofacial surgeon or a plastic surgeon. What happens is, due to this, is proper protocols get followed. If you are doing it in any random place or in a place where skilled or qualified persons are not there, they might not follow the proper guidelines for sterilization and aseptic.
The reason for coming to Hairocraft is that I think 20 plus years of experience is there.
Exactly.
And that is the confidence.
Yeah, and I'll be glad to inform you that Hairocraft is also an ISO certified center here in Kochi. We follow all the standards internationally which are accepted and which are all in the best interest of the patient. So that is of paramount importance for us. The patient safety, again I will stress on it, patient safety is of paramount interest for us, along with getting the results. That is definitely there. So one thing is that. The other thing is, after procedure, you have to follow all the instructions given by the operating surgeon to avoid any kind of infections. Definitely. Since you expressed about the concern that sometimes this happens, and that the case that you're mentioning, I'm not details about the case, but generally speaking, I will say, as I mentioned, you are there, sterilization protocol, maintenance of cleanliness, lifestyle is also sometimes important. Along with that, your reports are okay or not, like are you diabetic, is it controlled or not, because those things do play a role in your wound healing. If your uncontrolled diabetes, if some person is a uncontrolled diabetes, then we cannot just simply go ahead with the procedure. We need to first get him evaluated by a diabetologist and get proper medication to bring it under control. When he is cleared by the diabetologist for a safe procedure, then we might go ahead and perform the procedure after getting proper safe clearance about the patient's safety.
See, I was told by some people that
Okay.
Vijay, don't do this because lifetime you should be under medication. So is there anything in that?
Actually, no. Some medications are there like minoxidil in males, sometimes finasteride and all are given, which will help you, but it is not absolutely necessary to continue it for your lifetime. For sometimes you can take it for good results. Just maintain it in a good way. Have a healthy lifestyle, proper sleep, less oily foods, proper head massages from time to time with good cleanliness.
Alone I can, or
Use
massage means how is it? I can do it on my own or?
yeah, on your own you can do it.
Okay.
It's just to improve the circulation in your.
Oh, I have a habit of cutting in and going
Yeah,
to
yes.
everywhere, but something comes to mind, I forget.
Yeah,
See, I am go to gym for workout.
Mhm.
So when can I restart gym after this procedure?
I will advise after 3 weeks you can advise.
Okay. Lifting weights and all this is not a problem.
No, not.
And recently only I started gym 1 year,
Mhm.
but I'm very much addicted to it. I used to be a good alcoholic, but now no. So luckily, I think alcohol will not help. Will have
Alcohol will have a negative impact, so you need to avoid all that.
Luckily, 4 years that is out. So if somebody is having a habit of having alcohol after procedure, how is it? Will it? I mean, how long to avoid alcohol? Is there anything like that?
Yeah, definitely. We do advise to avoid the alcohol for around a month.
Okay.
Or so. It is better if a person can extend it beyond that also, but minimum of 1 month it is advisable to avoid.
It is good as alcohol is out completely.
And also smoking. I'll also stress on it. Smoking is also advised to
I don't
avoid.
smoke.
Yeah.
But smoking is bad. I mean,
Yeah,
we'll
we
have a
advise
negative.
to avoid smoking after the procedure, also before the procedure, because then again, what again happens is with the smoking, there is a contraction of your blood vessels. Contraction of blood vessels will again lead to less blood supply in your area. The surgical area will have poor healing. There will be less take up of your transplanted grafts in the implanted area, so your results will again suffer. So smoking, alcohol, avoid.
Luckily, I am out of it. And I have one more thing. I told I'm addicted to gym now.
Yeah.
You can't see much mass and all this here, but I love going daily. It's a consistently
No,
going.
it's
And
a
I
good
do stretching and also do Shirshasana. So how about that?
Shirshasana, I will advise you have to avoid for now.
How long I should be stopping it?
Shirshasana, you have to place your
head
scalp over the floor, right? So we don't want the surgical area to be disturbed.
Oh, how long should I be? Because I love doing that now. But I will definitely not do it.
Yeah, but just avoid it for at least 3 months.
Okay.
Because that is again you are putting the pressure exactly over the surgical area.
It is clearly here. This part it will be
exactly
coming.
Surgical area. So that we don't.
After 5 months or 6 months, is it possible or?
Definitely after 5-6
No,
months.
absolutely
not
no
any
issues.
No issues.
So you're telling after 3 months or 4 months, I'll be completely, this area will be in current situation. Nothing.
After 3 months, as far as the soft tissue healing is concerned, it will in a very advanced phase. It will be near completion. As far as your transplanted hair is concerned, that will initially shed and you will get noticeable results only after 6 months.
So all this Shirshasana stuff will be better after 6 months or 7 months, no?
Yeah, then that's fine.
I'm asking you.
That's
That'll be fine.
Yeah.
Gym after 3 weeks I can start.
Gym after 3 weeks you start. The 3 weeks is, I'm telling you the reason behind it. Like since you are coming out of a surgical procedure, right? Body is stressed during a surgical procedure. Plenty of things, metabolism and everything is going on inside the body. We need some time for the body to stabilize and get to its own. So a 3 weeks rest period is advisable. After that, with light weights you can start. Gradually you can increase it.
After 1 month's time.
After 1 month you can gradually go back.
I'm in a mental position to take 1 month. Okay, that's it. There are some places which offer a price or which gives better pricing. But I've seen Haircraft a bit higher side.
Yeah.
But yes, about the 23 years is what excited. So can you please tell me why it is a bit more expensive?
Whenever there is same procedure being offered at a lower price, bring out inference from that there might have been some cost cutting. So cost cutting might have been done in maybe the equipments, maybe in the person performing the procedure. He may not be a qualified person, he may be a person not qualified to do a procedure but still doing a procedure, or the setup is not maintained in a proper way which is medically required to perform such a procedure. So as cost cutting happens, definitely price will come down, but the thing to ponder upon is what are we trading off. If this we are doing the cost cuttings, we are trading off our patient security, we are trading off our ethics. So patient safety, procedure to be done in a proper medical ethical way is more important than bringing the price down to increase the business or compete with people. That is all, I don't think is the right way to go. So therefore in haircraft you might feel it a bit expensive, but then again you are getting the best care in the industry, the standard care that has been recognized by the ISO 2. So that all you will be
And
getting
can I
here.
know who will be doing it, or what education, or what is the expertise in
Yeah,
haircraft?
definitely. You will be the procedure will be conducted by a maxillofacial surgeon. So we are specialized maxillofacial. I being a maxillofacial surgeon myself, we are specialized to do surgical procedures over the scalp, face, and everywhere. Training and our residency has taught us the intricacies of the human anatomy as far as head and neck is concerned. So that is the reason we are well trained to handle cases like hair transplant.
You told there is no need, it's not mandatory that I should take minoxidil or something. Or is there any specialized food which can help in growing hair? Because here only after transplant it will come, but once it comes,
Yeah.
is there any
See,
good food?
per se, there's any if there's any food for which will help in growing your hair, that we can't say specifically. But yeah, what I can tell you definitely is there are certain foods which will help you maintain your hair that you have got transplanted as well as your natural hair.
What is that?
And all those are green leafy vegetables,
Okay.
protein sources like eggs, milk.
Whey protein is good.
Whey protein is good. It is derived from milk. That's fine. Protein sources naturally, if you consume, that is still
The
more
best.
good. Like eggs, poultry, those all things. But what you have to avoid is oily foods.
Oh.
Too much of oil will definitely have a negative impact.
Okay.
So that you need to keep in mind.
And when this hair is kept here, will it gray out when we get older?
That is a natural phenomenon.
Natural phenomenon. It's natural thing. Again to the old question. Now you told about specialized people doing. I've heard that some area this technicians done this procedure and all this.
Yeah, that is what I was.
How can I guarantee that the people doing in haircraft are experts?
Because when you will be consulting initially for your procedure, you will have the liberty to ask all the questions, meet all the professionals who will be with you throughout your hair transplant journey. You will get to know who is doing the procedure for you and what are their qualifications. You also can have the liberty to meet them, put up your questions, any queries if you have, any doubts if you have regarding the procedure. We are always there to help you, to guide you, and to take care of you.
And how long will be this procedure?
This procedure will depend upon the number of grafts that we are transplanting. That is will be defined by the area that we are going to cover. So larger number of grafts will take more area, less number of grafts that take more area will take long time, less grafts will take less time. But an average timing which I can give you is 6 hours, 1 or 2 hours.
I don't know whether the question is right or not.
And
The day,
I'll just interrupt here. Those 6 hours will be including your extraction and implantation, the whole procedure.
Okay, so after the procedure, when I go home,
Yeah.
that day will I be able to sleep?
You will be able to sleep definitely, but while sending you after the procedure, we will give you proper dressing. As you had asked earlier, that why to do in haircraft being expensive, these all things are there that will take good care of your surgical area. Will give proper dressing. We will send you in a way where you will have the maximum comfort that is possible after a procedure. So we'll ensure all those things.
So I can
that you
lie
have-
down without any.
you can lie down, but we'll advise you to do not give too much of pressure into that area. We'll give proper dressing, not getting too much of disturbance with your pillow and all. but definitely you can lie.
Should I get that? What is it?
Yeah, neck pillow.
Neck pillow, should I?
Neck pillow also will advise you.
Mm.
So what it will do is it will keep your head elevated, but not without much pressure and direct
Oh.
contact with the.
That's what. That will be just for
Yeah,
2 days or 3 days.
Yeah, that is just for 2-3 days. Once you start getting healed up, gradually you can go normal sleeping
So
position.
after this, it's like a normal hair growth for life. Need
If taken good care of.
good care and any
Lifestyle will be there, your day-to-day habits will be there, your use of medications will be there.
And I've heard about PRP. Somebody
Yeah.
was telling that see, when we tell I'm going to do this, many advice will come now. PRP, we need to do it every 3 months, 4 months. Somebody was telling me.
Yeah.
So is it necessary? And what is PRP? Can you please tell me?
What happens is here is a tissue, hair follicle that we are transplanting and all, that is a tissue. Okay, and even hair follicle is a tissue in itself, and even if it is not transplanted, it is in its original position. So there are certain factors in our body which helps our tissue to heal and grow. Okay, so those factors are present in the plasma of our blood. We take those factors from the blood, we'll put it in a centrifugal machine and extract that plasma, which is rich in platelets and all. So those platelets and all will have those factors which will help in your healing process, also in your growth process also of body tissues, including your hair follicles. So that is why when we are injecting that PRP, we are giving it a boost to evolve well in a manner where it is less stressed out due to it environmental reasons, and there's good amount of growth.
So what is a gap required for
So-
PRP?
So gap will be around 25 days, 21 to 25
No,
days.
how much PRP should I
And
be?
sessions, we usually advise 6 sessions, 6 to 7 sessions.
With that, I can stop it completely.
You can stop it in between, like maybe after a year or two, you can get regular sessions in between.
Just
you can
one-
say 3-4 sessions, or even
Oh.
1-2 sessions is okay. But if you take it is good enough, because see what again is PRP is nothing but your derived from your own blood. It is your own
Will any
plasma.
side effects will be there? Or?
No, it will not have. That is why I am trying to explain it to you. It is derived from your own plasma, PRP. So PRP will not have any side effects because it is ultimately your own body composition,
Oh.
which has those factors which will help in maintenance of hair as well as good growth.
So no worries in that aspect.
No worries.
In Malayalam, there was a saying,
Okay.
very interesting saying. Asuyakkum kashnikkum marunilla. There is no medicine for jealousy and baldness.
Okay.
Now, anyway, for baldness there is medicine, and I'm also going to, and I don't have jealousy. Yeah? So I have a question, doctor.
Yeah.
Technology, initially you told patch method was there. Now we are using it pen.
Yeah.
What is the latest stuff? Is there anything which will be coming which I might miss, or if I do now, will it be something wrong, or should I wait for the technology? Or I've heard about the long hair something. Please, could you?
Okay. What happens is recently some surgeons have started doing a long hair transplant. It is generally done in patients who have the need of immediate results, who have some requirement that they need to have those results immediately. We can also sometimes call this procedure as a preview procedure. Patient will have a preview of what they will look like after the hair transplant instantly after the procedure, because what we are doing there is we are extracting the hair follicles without shaving the area. Without shaving the area with the hair with its original length. The equipment is slightly different in that, with which we'll take follicles out. We'll take that follicle with the existing length of hair without shaving the donor area, and we'll implant it in the implantation area. So after the procedure, you can have a view how your transplanted hair looks like on your face. So that is the thing. Now, as everything has its pros and cons, so the pros with this procedure is that you can get to see immediate results. As far as speaking of cons, the thing is that this is a very complex procedure to do, because with the hair intact, if we are taking it out, we can't take much of the hair follicles in a single session. the number of follicles would be less, the area that we can cover would be a bit less, right? So that is one. Other thing is, since that area we will be extracting it without shaving, so we cannot maybe take proper care after the procedure, which may lead to chances of infection. And then again, can be avoided with proper care, but still compared to FUE, sometimes chances of infection might be more in type of transplant.
Okay.
Okay.
So currently you are using the best technology.
Yes.
Or can I ask you, it might be a funny question or not. If Salman, definitely, I think he has done a transplant
Yeah,
or
right.
celebrities.
Right.
So what Vijay Chandra Bose is going to do? Is it the same thing as they does, or is there anything more which has come into the world in world of transplant?
No. Actually, we have even evolved from there. The time when they got their transplants, we have evolved much more from that time. Procedure is FUT still, but the technicalities and other aspects we have incorporated in our practice, which helps us to get
So
even more better results.
this is the best technology
Exactly.
available now.
This FUE is the most popular and most widely used technology as far as hair transplant is concerned, because the other old technology was FUT, follicular unit transplant, where we had to take a strip of scalp, then we had big lesions due to the incision, and it led to a presence of a linear scar at the back of the donor. So it did not have a very aesthetic look when you could view the donor area. Sometimes those linear scars were visible. So definitely FUE does not have any such problem, because we are extracting only the small follicular units, individual units, and healing is also faster. Post-operative surgical complications are also much lower in this case, and it gives the best results as in our experience till now.
I got the answer. So in a matter of 8 months, I'll be a different person,
Definitely, that I can.
provided I follow your instruction.
Yeah, exactly. That is very important. Following all the instructions being provided by the surgeon as well as the staff.
And I've heard this part. No, what do we tell this?
Crown. That is called crown.
This area you can't do transplant. I've heard something like that.
Not per se, we do transplant in that area, but then again, after transplantation, the retention in this area might be slightly lower than what will be in the front of region. Front of region, we are expecting around 90% of the grafts to be retained after implantation. But in the crown area, what happens is the blood supply is slightly deeper in that crown region. So what happens is that proper nourishment to the transplanted hair follicles is slightly less as compared to the front region. That can cause a little bit of more grafts to be lost after transplantation, thereby impacting the results slightly when we compare to the front region. So that is the thing.
And about the oils which we use after this thing, is there any specific oil which we should use, or normal coconut oil we can use? Any shampoos or any
And initially, we will be giving you some specific oils that you have to use. Later on, maybe you can go for naturally procured coconut oil and all.
Actually, you're telling that in 8 months, after 8 months, it will be completely normal.
Yeah, the healing would have completed. Your hairs would have started growing out. You will be able to see visible results in your appearance.
Okay. So let good things happen.
Definitely.
And
We
how
are
will
also
I look?
excited to
I am really excited to see how the new Vijay Chandra Bose will be.
Exactly. Since you are so enthusiastic about this thing and to change your appearance, we are also striving to give you the best results, and our happiness lies in your satisfaction. Okay, thank you so much.
Okay, sir. Thank you.